Welcome back. You're watching SABC News. This week is National Pregnancy Awareness Week, which aims to promote health during pregnancy as well as new motherhood. One health concern brought under the spotlight is depression during and after pregnancy. According to the South African Society of Psychiatrists, between 21 and 47% of South African women experience depression during pregnancy, and 31 to 50% suffer postnatal depression. Depression during pregnancy is less well known than postnatal depression and often goes undiagnosed. Depression during pregnancy increases the risk during pregnancy and during childbirth. The South African Society of Psychiatrists says that women experiencing depression during and after pregnancy should be aware of the medical and social support that's available to them, including antidepressants, psychotherapy, and antenatal support groups. Well, for a little bit more on this, we're now joined via Zoom by Dr Lavinia Lumu, who's a member of the South African Society of Psychiatrists. Dr Lumu, thanks very much indeed for joining us. I have to put my hand up and say I was also quite ignorant about prenatal depression. Is that quite common?
Yes, prenatal depression is quite common. We are seeing increasing rates of this, and in actual fact, the terminology is starting to change because women tend to only get properly diagnosed postpartum or postnatally. What we are finding is that it has its onset during pregnancy, so we prefer the term perinatal or peripartum depression, so that it's picked up during pregnancy, managed, thereby decreasing the rates of postnatal or postpartum depression.
All right, we'll talk about postpartum just now. What is it, do we know, that causes this depression to kick in during pregnancy?
Yeah, that's a very crucial question because what we are finding is that, pregnancy is a physiologically stressful event. And there are lots of hormonal changes, and these hormonal changes make one vulnerable to mental illness during the time of pregnancy. So it's a crucial time for us to be aware of it so that we can start screening and managing women early on.
It's been misdiagnosed over time, I guess, because we've always understood, particularly as men, that, women can get a bit cranky when they're pregnant, and that's what it is, without thinking that it could be something else.
Look, during pregnancy, there are lots of hormonal changes that happen that do contribute to the normal mood changes that we do see. But what we see, especially after birth, is baby blues, and that's quite common and often dismissed. It's normal in the first 2 weeks for a new mother to feel overwhelmed, weepy, changes in appetite, sleep energy. But what is concerning is a large percentage of these women actually have postpartum or postnatal depression, which is quite serious and can result in significant dysfunction and impairment. And we are seeing rates of untreated depression. We hear it in the news all the time, mothers dumping their babies, increased rates of infanticide where mothers unfortunately kill their babies. And this just speaks to the negative consequence of untreated depression in pregnancy.
All right, perhaps a last question on peripartum depression. How does one diagnose it? What are the symptoms that people should look out for, and perhaps women feel that, maybe I need to see someone and talk about it?
All right, very important question. The most common symptoms include feeling really depressed, a loss of interest in activities that one used to enjoy, feelings of helplessness, worthlessness, guilt feelings, changes in sleep, appetite, energy, so not sleeping, feeling tired all the time, not eating or eating too much, and obviously the biggest red flag is the negative suicidal thoughts that may kick in. The important thing to be aware of is that this would carry on for a period of at least 2 weeks. Anything more than 2 weeks is a red flag, and one should immediately tell their healthcare practitioner, general practitioner, midwife, so that they can get help. Because the important thing to be aware of is that we're in a position where we can medically manage depression during pregnancy relatively safely with medication.
Can the baby be harmed by depression during pregnancy?
Another very important question. Research has indicated that actually untreated depression can cause the same amount of harm, if not more harm, than a mother being on medication. It increases the risk of complications during delivery and for the baby in terms of attachment and bonding. So we are encouraging people to initiate treatment during pregnancy to prevent the negative outcomes after delivery. And it's really safe for mothers to be on medication and to even breastfeed on medication.
All right, let's talk postpartum depression. Typically, what do you see? Is it a rejection of the child? Is it just depression as we understand it? What do we see typically in postpartum depression?
So in postpartum depression, you get an exacerbation of the symptoms that I've described earlier.
Yeah.
So excessively depressed, weepy mother who's sort of negligent of the child, not able to look after the child, excessive guilt, crying, not sleeping or sleeping too much. So those are the key red flags, and I can't overemphasize the negative thoughts, thoughts of suicide, of infanticide, which we need to look out for. So within the first 2 weeks after delivery, it's referred to as baby blues. But if it persists beyond that, one needs to seek help immediately.
All right, and it's fully treatable?
It's fully treatable. We have antidepressants that we can use, and research has been made available that during pregnancy and when a mother is breastfeeding, there's no risk of significant congenital abnormalities or neurodevelopmental abnormalities in the child. So it is better to have a stable mother who's healthy, who goes home, who's able to breastfeed and care for her child, versus having her untreated and the negative consequences thereof.
All right, and we've run out of time, but I think an important question really is, what can partners do, especially if the partner, the wife, the partner doesn't want to seek treatment because the depression perhaps is probably informing that?
Yeah, that is a challenge. I think there's a lot of stigma, and the stigma acts as a barrier for access to healthcare. It's important that someone assists with the baby in terms of feeding and caring for the baby, and the mother needs to be encouraged to seek help, because untreated depression can result in quite serious outcomes, suicidality, and that would require urgent assistance through hospitalization.
Dr. Lumu, we're going to have to leave it there, but thank you very much indeed for sharing this knowledge with us. It's very, very important to get this message out. Thanks for your time.
Thank you for having me.
Thank you. All right, that's Dr. Lavinia Lumu, who's a member of the South African Society of Psychiatrists, asking us to be vigilant and look out for not just postpartum, that's depression after delivery, but also during pregnancy, which is often not diagnosed.